The DICE study, which stands for Diversity in Care Environments, is looking at housing schemes that provide care and support for older people.
As the population ages, there's growing recognition that we need a range of options. One of those options is housing with care. And that offers individual older people the opportunity to live independently in their own flat, with care and support available if they need it, but also offers the opportunity to take part in collective activities in social spaces that are provided on site.
We're interested in the ways in which housing schemes support and promote social inclusion for older people living within those schemes.
So it's really important that we understand the different social identities of older people and that we support them to feel included in the setting where they're living, but also in the wider community.
We've worked with 3 housing providers who all provide different types of housing schemes that provide some care and support services for older people with varying level of needs in later life, so that we could capture a different range of perspectives from both residents and staff.
In total, we interviewed 72 residents and 21 staff across the 3 housing providers. We also interviewed 23 stakeholders, which included policymakers and organisations which work with supporting older people and older people's housing.
The age range was mid-50s to 90 plus. The average age was 72. So that included people who identified as lesbian, gay, bisexual or transgender, people who identified as Black, Asian or another ethnic minority, and also people with disabilities. So that could be a physical disability, chronic long-term health problem, or cognitive disabilities such as a learning disability or dementia.
Some of the methods that we used included interviews with residents and staff, longitudinal interviews where we had repeated interviews with residents over a period of time, and a survey which residents completed themselves.
We designed our survey to match, in many respects, the questions asked as part of the English Longitudinal Study of Aging, or ELSA, so that we were able to understand the experiences of people living in housing with care and support in contrast to people living in the general community. Questions that allow us to measure things like loneliness and social isolation. We also added a few questions of our own, their perceptions of housing, how they felt about their housing, and experiences related to discrimination.
Through this study, we've learnt there are 4 key considerations when thinking about how to provide socially inclusive living environments for people in later life. First of all, there's the importance of proactively reaching out and engaging with residents who belong to minority groups and minority identities. Secondly, the physical design of the scheme and making sure that schemes provide social spaces which facilitate residents regularly interacting with each other. A third consideration is the importance of staff on site and the ways in which staff have opportunities to build relationships with residents and respond to any conflicts between residents or when residents may be feeling excluded from scheme life. And a final consideration is the importance of supporting residents to be actively involved in the social life of schemes.
What has impact for me is hearing people's experiences over their life, the things that have worked for them, the things that have challenged them, and hopefully to ensure that there's better training and support for older people so that they can live the life as they want to.
Throughout the course of this study, we've seen some great schemes out there that are doing some really important work in supporting people in later life to maintain their independence, maintain their existing social networks, and to build new relationships, new friendships, and new good neighbourly relationships within schemes.
I do think that government is now listening to different groups of older people. We need more of that, and we need to convince providers that they need to talk with different groups of older people so that they start planning and designing and funding housing with care so that it meets the different aspirations of all older people.